Migraine piercing. Humbug or effective support for sufferers? Biofeedback, muscle relaxation, acupuncture. There are various options that can help curb the recurrence of migraine attacks. Another method has been spreading for some time, the migraine piercing. What exactly is it all about? And does the piercing for migraines really do what it says on the tin? Those who suffer from migraines often have to struggle with immense restrictions in everyday life. In addition to the severe pain and any accompanying symptoms, for many sick people there are also stresses such as lost work and a reduced social life. If the attacks also occur very frequently or even develop into chronic complaints, it is hardly surprising that so many sufferers are willing to take more unusual measures against migraines in addition to traditional treatment options. This also includes piercing against migraines. Attached to the correct place on the ear, it should be able to noticeably reduce the frequency of migraines. The migraine piercing is based on the principle of acupuncture. In the Far Eastern form of therapy, needles are placed on certain lines through which, according to the theory, the body's energy flows. In the case of a migraine piercing, a needle is not only temporarily inserted, but an ear stud is permanently attached. The piercer locates the acupuncture point against migraines in the ear. It lies on the cartilaginous fold above the entrance to the ear, and pierces the so-called Daith piercing exactly there. Depending on the severity and location of the pain, 2 Daith piercings are used, one on each ear. What piercing can do against migraines? If you suffer from frequent or severe migraines, you may quickly be tempted to try methods such as migraine piercing, and hope that the long-awaited alleviation of the symptoms will finally occur. In addition, countless positive experience reports can be read on the internet. Therefore, some sufferers consider getting a piercing for migraines. However, the opinions on Daith piercing are not entirely positive. It is not recognized scientifically as a medical remedy. There are currently no studies that prove it has an effect. Instead, the placebo effect seems to play a role. Put simply, the patient has such high expectations of the piercing that he subconsciously influences himself strongly, and actually perceives the desired change. Many doctors and migraine experts are extremely skeptical of the Daith piercing. The German Migraine and Headache Society even published a statement in which it urgently advises migraine sufferers against migraine piercing. There is no scientific evidence of its effectiveness, and the health risks should not be ignored. Piercing can not only delay wound healing on the ear cartilage, but also visible deformations of the ear are possible due to inflammation. Conclusion: a migraine piercing is currently not recommended. Due to the undetectable effect and the possible health risks, migraine patients should refrain from a corresponding piercing. Instead, they should talk to their doctor and use conventional treatments such as triptans and pain relievers. In addition, they should get advice on non-drug therapy approaches such as progressive muscle relaxation or homeopathy.